Thank you very much, Dr. Maisa. Please welcome Mr. Omar Ayesh, the CEO of Electronic Health Solutions. Let's clap again once he comes up, because he's just fixing his microphone. Sorry? That's not really in the program. Yeah. I didn't make the program. Let's clap again for Mr. Omar Ayesh, CEO at Electronic Health Solutions.
Thank you very much. Thank you, Intaj, for giving me this opportunity to talk about our digital transformation in the field of healthcare in Jordan. Our journey started when His Majesty ordered the launching of this program. It was launched when EHS, Electronic Health Solution, were established as a non-for-profit organization and entity to lead the way in the digital transformation in Jordan. We started by leveraging technologies and preparing the right human resources to take care of this digital transformation program. We started by introducing our first program, which was the Hakim program. It was based on electronic medical record and all solutions that comes with that. Then in 2013, we introduced ILM. That's when we started thinking about human resources. ILM is the Electronic Library of Medicine, where it provides access to healthcare workers, university students for getting access for medical resources and clinical decision supporting tools and e-learning tools, e-journals, e-books, and so on. And it's free of charge for everyone in Jordan. Then we looked at bridging the gap between the academia and between the industry and technology. So we found out that we need to introduce Hakim Academy, which is responsible for elevating people knowledge in the field of digital transformation, in the field of healthcare, and so on. Then in 2019, we found out that, and the world found out that the new oil is data. So we have a huge amount of data within our databases. So we said that we need to utilize this data to help healthcare workers, to help decision support, to help decision supporting tools for decision makers, and to help researchers do their research when it comes to healthcare. So the Hakim program, today, if we look at where we are, we have around 7 million records today. We have covered almost just over 208 organizations within the country. We are in Jordan, north, east, south, west. We're covering all Jordan. Today we have covered around 80% of the bed weights in Jordan. We have covered almost 50% or just over 50% of the comprehensive clinics in the country. When we go and do the implementation, we don't just bring in these. We do a full transformation for the organization where we go to. We start by introducing infrastructure. We're introducing hardware. Then we look at the implementation process where we do full clinical transformation for the organization. We look at system re-engineering. We look at introducing change management. So we need people to feel the digital transformation. It's a total transformation from what they do in the manual world to a digital world, which is just bringing PCs. Many people think that going to a hospital and automating that hospital just bring a PC and a software. It's not like that. It is a total transformation trip that we take with the organization, and we do full training for all staff. And I want to tell you one fact that was recommended to us by our fellows at the VA in the US. If you need to succeed in the digital transformation, you need to have among your team a clinical team. Half of EHS 300 employees are clinical teams. We send a nurse to the nurse, we send a pharmacist to the pharmacist, and we send a doctor to a doctor. So our team, not just technical team. Many companies or many organizations, they only have technical teams. As a fact, from many experiences that we looked at, it would not work as a successful way if it were only technical. They can tackle technical problems. But when it comes to the business, when it comes to healthcare team has to take care of that. We looked at, during our journey, we looked at the patient. Today's patient is different than patient 50 years ago or 30 years ago. Our patient is educated. Today, with the availability of technologies, lots of information about the disease the patient is suffering is available online. So patients are aware and they are very acquainted of their circumstances and their disease. So we started by introducing one of the first patient portals in Jordan at the Ministry of Health. We launched that. It's called My Hakim. We launched this portal early in 2021 after the COVID. And then we have introduced the newest version of that early this year, in February actually, of 2022. With that portal, patient can access their allergies, they can take a look at their medications, appointments, immunizations, and lab results. And with the newest version, today, this year's version, patients can order their medication online. We have done a project together with MOH, with the Jordan Post, and with IFO at IRCOM to take care of delivering medications to patients to their home. And it has been a successful project since March this year. At the same time, we looked at the doctor. The doctor is not at his office every single minute. He might be at home, he might be in the Dead Sea having fun, but the patient is in the hospital. And he gets a phone call from the hospital telling him that your patient is suffering from 1, 2, 3, 4. What shall we do, doctor? So he can get access to his through his mobile. He can get access to the patient record. He can view all what medical information he needs to take the right decision and direct the people on call or on shift in the hospital to deal with his patients. At the same time, with the COVID, when the COVID started, we have introduced Hakim Academy e-learning platform. This is taking care of teaching people, teaching Hakim users and university students on the digital and bioinformatics programs that we take care of. Data. Everybody's talking about data. We just heard Dr. Sana talking about data, Maisa, sorry, talking about data, and everybody will be talking about data at this conference. So we looked at this patient data, medical records, around 7 million medical records, hundreds of terabytes of medical images that we have, all type of cases, because we're covering the whole country. So we have lots of data within our organization. So we have, upon the directives of His Majesty, we launched the Huda program, which is Health Data Analytics, in 2019, just few months before the COVID. We looked at big data. We looked at the data transformation and summarization. We looked at analytics and visualizations. We provide reports, we provide dashboards, statistics, we provide studies for researchers and for healthcare workers or healthcare providers. we do a data warehousing, and we apply AI algorithms and BI tools within our solutions and services that we provide. Future goal, yes, we have not achieved what we are looking for 100%. We are improving. Every day we are introducing new stuff, and we are working closely with our partners at MOH, at RMF, at KCC to introduce new solutions and new AI tools and applying standard operational procedures in the healthcare sector to be synchronized with the government AI strategy. We live in Jordan. We need to have a clear strategy, which luckily Moody has worked on that in the past few months, and they came out with the national AI strategy. We are synchronizing with that so to reach to, where the country wants to be in the coming future. Our vision is, when we started our program in 2008, His Majesty's vision was a single electronic medical record. We did not reach that yet, telling you the truth, but we have a single record at RMS, we have a single record at MOH, a single record at KSCC, and other institutions have their own records, like university hospitals. So our plan is to have, to have our plan is to have the data exchange. Data exchange feature or technology that we already have will be integrating the MOH system with the RMS system, with the KSCC system, with other systems at private hospitals, because today many private hospitals have their own medical records, and we have also planning to include the medical insurance to be integrated with that, the private sector to be included through the Hakim claim that we are providing for the private sector, and at the same time, with that, today we have 70% of the data that we can work on. With that, we will reach almost 100% of the data, because Huda, or the data analytics program, is for Jordan, not just for the public sector. Everybody has to be involved in that. All data has to be analyzed, all data has to be worked on, so to get the best value out of that. And thank you very much.